Felipe, good afternoon. Thank you for joining me. I just want to have a brief discussion with you. If you could sit down, please, about our clinical day today.
Okay.
How are you feeling after today?
Excited to see what you have to say about me.
Okay. All right. So I just wanted to let you know before we start the meeting that no one is born knowing anesthesia, and you have to acquire the certain skills by coming to clinical, and you're going to start coming to clinical more. And just I want you to take this, and this is an opportunity for you to grow. So I want you to take this as not me like putting you down or anything like that. This is just an opportunity for you to grow, to see what you need improvement in, and just go from there. Okay, you're just starting, you're just gonna become a senior now, so I know that you're gonna do great. Okay, so first we'll go over setup and preparation. For this, I gave you a needs improvement. Okay, I arrived here at 6 a.m. Cases start at 7 o'clock, and you got here at 6:45. I set up everything for you, and you know, going as when you start becoming senior status, that's not what we expect from you. Even as a junior, you should be getting here before the CRNA.
I apologize.
Okay. Was everything okay? Did you?
I was having a flat tire. I had a flat tire. I should have communicated. Sorry.
Okay. Okay. Well, I hope you got that fixed and everything's all right now. All right. For the pre-anesthetic patient preparation and assessment, I gave you a 3 on this. 3 is average. You failed to communicate to me. I'm not sure if you talked to the attending or the surgeon about it, but the patient had a penicillin allergy, and you were drawing up Ancef.
I didn't tell you about it, but I had spoken to the surgeon in terms of what coverage he wanted for the patient, and he felt like Ancef was okay. I failed that part. Okay,
so you know, just communication, and so I'm giving you a 3 for that one. Okay, for plan of anesthesia care, I'm giving you a needs improvement. I basically planned the whole anesthetic. When I asked you what you thought we should do, you kind of just left it up to me, and that's not the level that you need to be at right now. You need to be formulating your own plan of care, especially if the provider is asking you, what do you want to do for this patient? We're asking you that to see how your mind is, how it's processing, and what you think is appropriate for the patient and the surgery. Okay. For knowledge base, this is equipment, pharmacology, pathophysiology. I gave you a needs improvement. You know, you didn't have closed loop communication with me at any point during the procedure. You kind of just, I would tell you to do something, you kind of just did it. So you gave the wrong dose of ephedrine. I told you to give 5 milligrams, and you gave 5 cc's, right? Yeah. So that is something that is not okay and could have caused serious harm to the patient. Thankfully it did not, but it could have caused some serious harm to the patient. So as far as knowledge base, do you understand that you were using the incorrect vent settings?
Yes, I noticed I was on volume control instead of pressure control for that case.
During the patient was on steep trimmed Ellenberg?
Yes.
Yeah. Okay. So I need you to review that, you know. This is something that's gonna come with time, but at this point, becoming a senior, you're expected to know this stuff because you've already taken this class. So I gave you a needs improvement for that in knowledge base, and as well as, you know, upon emergence, the patient was put on PSV Pro. You know, thank you for checking the twitches. This is good, but you should have realized that the patient had 0 twitches. So we shouldn't have put them on PSV Pro at that point yet. And also 0 twitches, do we give neoglyco when a patient has 0 twitches? No. What would be the more appropriate medication?
Gamma-dex would have been better.
Right.
Yes.
So for that I gave you a 2. Application of knowledge and anesthetic patient care, I gave you a 2 for that one as well. Just because of the things we've already spoken about, the wrong vent mode. You've already given me what you could have done, so I appreciate that. That means that you understand that you did something wrong, and going forward, that's not gonna happen anymore, correct? Okay, so same thing with that one, with the patient placed on PSV Pro with 0 twitches, and you know, you couldn't answer why the patient had high peak pressures when you had them on steep trend Ellenberg with volume control. But I know now you can.
Yes.
And I know that's not going to happen anymore.
Yes, it won't happen again.
Okay. So psychomotor skills, I gave you a 3 average. Great intubation. You did really well with intubating the patient. You placed an IV, placed an 18 gauge IV. You know, a little maybe overkill for the procedure that we were doing, but I appreciate your enthusiasm, and I know you want to practice your IV skills. So that's awesome. Okay. For anesthetic management overall, inductions, maintenance, and emergence, what do you think you deserve for that one?
I needs improvement, since of everything you've explained to me so far today, yes.
Okay.
It needs improvement.
Awesome. So that's exactly what I gave you. I gave you a needs improvement. Okay. And documentation and patient report. Also, you know, at this point, you should be documenting more, which I did. You were a little preoccupied a few times with the documentation, and I had to reorient you into focusing on the patient. But that's gonna come with time as well. So I gave you a 3 for that one, okay? Professionalism and teamwork. You're, you know, very receptive to what I'm telling you, what I was telling you throughout the case. You were very, very receptive, and I think you're gonna do great. But for this one, I did give you a needs improvement, just because you didn't arrive on time. Time is before the CRNA, right? If your case is expected to start at 7 a.m., you need to be here at least an hour before that. You were here 15 minutes before that. So you didn't communicate with me throughout the case. There was no closed loop communication. And, you know, because of that, I'm gonna give you a 2, okay? Overall, it's an average, and you need improvement, but I think based on how receptive you are, and you've already corrected all the things that you did wrong, even before I told you what they were, I think you're gonna do great, and just take this as a moment of growth. And I'm here for you throughout your clinical journey for anything that you need. And I hope that with this review, you will continue to come to me. So I would like to see how you have progressed, okay? And I'm excited to see your performance moving forward, okay?
Thank you.
Thank you so much, Ms. Felipe.
Thank
you.